Hi, it's Bobby. I just wanted to do a little video talking about levels of care because it's one of the things that we have to address in your project. But before I do that, I'm going to get the light off behind me. Sorry. It's my light, my plant. But before we do that, I want to talk a little about more about the modules. On there is a bunch of stuff. There's a lot of stuff. And the reason why there's a lot of stuff on there is because it's kind of like a la carte. You get to go pick out whatever it is that is the most useful for you or that suits the requirements of the class. So there's a specific discussion post about Claudia Black. You'll have to watch the Claudia Black video. You know what I mean? But there's a lot of extra stuff in there that's there because it's relevant and interesting, and I thought it'd be helpful. So I want to talk about level of care because that gets to be really important. Back when I first got in this field, level of care was determined by your health insurance, sad to say. And there really weren't a lot of levels of care. We had people, we put them in for detox, and then we usually had them stay for residential, and residential somewhere was about 30 days. The insurance companies somewhere got the idea that quality treatment for addicts and alcoholics needed to last about 30 days, and that was what would be in their best interest. So typically people would come in for treatment and they'd stay there 30 days and then they leave. Then they come back in again, unfortunately, at times, or sometimes they'd stay out. Then that changed. Insurance companies got wiser, but not only that, I think we began to realize that that's not always the most appropriate way of treating somebody. You know, what about if addiction is really about difficulty living life on life's terms, then don't I need to live my life in order to be able to learn how to recover, right? I mean, it makes sense. So if you put me into a place where there's nobody around that is my stressors, then it's going to be easy to stay sober and stay calm there because there's nothing bothering me. But let me do as much life as possible while I am getting treatment, and then we can create some real change. So what we really want to strive for now is trying to get people into treatment at the least intrusive level of care so that they are able to live as much of their life as they can while they're getting treatment. However, I do remember years ago women saying to me that in order to be able to stay sober, you have to have skills, and in order to have the skills, you have to stay sober. And that does speak to residential treatment. That is one of those benefits of being someplace where nothing can bother you and you're there in a residential facility. But we don't usually have the benefit of being able to do that very long anymore. And, excuse me, and also, I don't know that it's always I think it's counterproductive. So the first thing, level of care, is level 1 is the outpatient services. And I also posted something on this module about level of care. And exactly what I'm reading from is what is on there. So the first one is outpatient services, and that's where people they do everything like they normally do. They work, they go to school, they take care of children, they do whatever it is that they do, but meet regularly with a physician and treatment professionals for evaluation, treatment, and follow-up. So I have clients that see me and then they also see a psychiatrist. Or I have clients that see me, they see a psychiatrist, and they may see their medical doctor for something. So there's usually a team of people, not necessarily like mine are not associated with me. There's a psychiatrist in my office, but that's not the psychiatrist I'm referring to. But you know, there's usually a team of people that gets together to try to be able to help somebody. But even if that's not true, it's when a client comes to a therapist's office and is seen, you know, an hour a week, maybe 2 hours a week. It's usually rather reasonable financially, and it is usually 6 hours or less for. It says 9 hours or less for adults, but that's really. I've never seen an outpatient program that much. I've never really seen an outpatient program that goes more than 2 hours a week. So I have, however, seen intensive outpatient that goes for 9 or 10 hours a week. So intensive outpatient is when somebody comes to treatment a minimum of 3 times per week for 3 hours a day. And some IOPs are during the day, some are at nighttime, some allow you to continue working your job, some you have to take a leave from your job to be able to do it. But the goal is there's usually 9 hours of psychoeducational, group therapy, experiential therapy, and then there's usually 1 hour working with a therapist privately or doing family therapy, Sometimes family therapy can also be included in that beyond the 9 hours, that we may just do family groups. But it is it's where people come to treatment for 3 times a week, 3 days a week, a minimum. They can come more than that, but they have to come, but they don't come for longer than 3 hours. And the reason why that is because if they come for more than 3 hours, then it's considered to be partial. So IOP is something that is also financially more sound. Insurance companies love IOP. They love IOP a lot, even when it's not necessarily the best form of care sometimes, because it is reasonably priced. But it is also a lot of work. I mean, people come and they spend, that's a lot of time. Can you imagine working your job and then coming to 3 hours of therapy at least 3 nights a week, and then coming to see an individual therapist? That's a lot. The agency that I work for, that I run, is an IOP program and an OP program. And then that this level of care, we don't house people, and there's a lot of really big issues around that, because there are places that actually do house people, and you're not really allowed to do that. You can't house people where they're getting treatment. So a lot of places now have gone to this Florida model, which is where people live in housing, and then they go to treatment facility. I like keeping it really separate. So people who come to the Way Home Treatment Center a lot of times will they don't live at home. They don't have to live at home. Some of them do live at home, some of them don't live at home. A lot of them live in halfway houses. Then they're run by somebody else. And there's something called a FAR accreditation, and I'll put that on the internet, because what originally happened was that there's been so many problems with halfway houses and 3/4 way houses, where people have been getting, I don't know if you remember all the stuff about Del Rey a while ago, like maybe a year and a half ago in the newspaper. They were talking about all the problems with all the recovering people down in Florida that were all in Del Rey, and people were relapsing, and there's halfway houses everywhere you look, and it was just kind of a hot mess. And I've known places that were kind of bad because there was no regulations. People would relapse while they were in the halfway house, nothing would happen. I've seen people die in halfway houses. So FAR is an accreditation board that has gotten together, and now clients who come to treatment with us if they're going to live in a halfway house, they have got to live in a FAR accredited halfway house, because then we know that there's certain restrictions and certain controls that have been put in place to make sure that it's a reputable place. So, and the thing I gave you talks a lot about their services, by the way. Partial hospitalization is when somebody comes to treatment. It's the most rigorous of all outpatient programs, and they come about 20 hours a week for individual, group, and family therapy are the major components of treatment. As is psychoeducational. Participants can often utilize services like yoga and acupuncture during the day. It depends on how diverse the services are. Frequent contact with medical and therapeutic staff is expected integrated into the partial hospitalization services. So usually it is a minimum of 6, usually the way it works is that it can take anywhere between 4 and 6 hours a day, and then the number of days plus another couple hours for individual psychotherapy is how many days a week they come. So a lot of times people come to therapy for 5 days and they come 4 hours a day, or they'll do, any combination thereof. It depends on what the rest of their life is like, but it's really hard to hold a job and do partial because it is so demanding. And the reason why they call it partial is that you're doing pretty much most things besides sleeping in a bed in a hospital. You have medical care there. The doctor oversees your care. In IOP, your care is being overseen by an outside physician. It's not somebody that's at the facility. We require that people have a outside physician that they they have to have a physical in the last 6 months in order to be able to determine that they're healthy enough to do an IOP program, and also that they're not having withdrawal symptoms. In partial, there's more monitoring that's able to be done, and actually some people can do an outpatient detox through PHP because there's so much supervision. Residential and inpatient services are the next level, level 3, and that is where patients whose addictions have created significant functional impairments. It's for patients who require more stability than they can achieve at home. At this level, patients live on-site or close proximity to their treatment, and then treatment's offered around the clock, 24 hours a day, 7 days a week. So let me tell you why this happens. So there's another level, which is medically managed intensive inpatient services, but so let me tell you about residential. So residential is where people who have completed detox are able to be in a center where they're being monitored 24/7. And the reason why that's so important is many people, depending on how much they drank and or used, and what their medical status was, and who they live with, and what their home environment is like, and the number of problems that have been created by their addiction, they may need to have really strong care. They need to be in a place where somebody's going to be monitoring to make sure that they're okay. And especially people going to do trauma work in their addictions, it oftentimes is really a better idea for them to be in a residential facility so that they can be monitored, because people have reactions later on. You know, they may do a lot of really good work while they're in treatment during the day, and then 3 hours later start to like sob uncontrollably or become really, really angry, and it's called an abreactive reaction. It's a reaction that happens later to a clinical setting. And so, you know, residential helps keep people in a safe place. It's really good for people who are older, or people who have not great health, or for whom addictions really cause them a lot of problems. Sometimes people's families are a lot of problems, and it's not the place for them to be. Sometimes they are there because they have had because they tried every other level of care and it doesn't work. And I think that that's one of the things that becomes really important. Residential should only be after somebody's tried every other level of care. So the best way to do this is a person starts going to outpatient, then they go to IOP if that didn't work, then they go to partial, and then they come to residential. It doesn't always work that way, but that is the best way to be able to do it, because it allows people to have the chance to be able to recover and get healthier while they're maintaining as much as they can in their own life. So there's a lot in this paper about medical monitoring, but it says level 4, medically managed intensive inpatient services. The highest overall level of care, ASAM level 4. ASAM is the American Society for Addiction Medicine. It is a great organization to look into. And they do a criteria that is basically how we set. Oh, I should put that in there. I think I will. ASAM, they're the ones who kind of give you this like little, it's like a little form you fill out, and it says, you know, like it asks questions like when people come to treatment for ILP, it asks questions like, are they free of withdrawal symptoms, and if they're not, can the withdrawal symptoms be monitored on an outpatient basis? So you have to go through and check off whether or not, you know, which one applies to them, and neither one applies, and they don't deserve to be, they shouldn't be an IOP. So medically managed intensive purposes at the highest level, and usually that is because people are needing detox or they're having medication assisted treatment. I am not a great person to talk about medication assisted treatment, but I will be by next week because I'm going to get more information for you. I work with a lot of clients who are in the MAP program where they get they take Suboxone, they take Naltrexone, they take but I can't remember the name of the shot. But they take medications to help them assist them in staying off substances. So coming in for somebody who's been drinking heavily for a long period of time, oftentimes can't get sober on their own. They can't stop drinking, and if they were to stop drinking or using, it could be life-threatening. So the ones that are most likely are alcohol and benzodiazepines. Those are the two that are most likely to cause a seizure, and that can kill somebody. Heroin is really hard to get off of. Opiates are very hard to get off of in an outpatient setting, although people do it using the MAP program, using medication-assisted treatment. But it is really painful. Like, people don't die from opiate withdrawal, but they certainly wish they would. And the thing that's most likely to kill somebody who is an opiate withdrawal is when I just can't stand it one more second and I'm going to get high. And I use the same amount of opiates that I was using prior to starting my detox, and I die as a result of overdosing. So, and I remember the time when we used to be able to be a lot freer when it came to detoxing people, but now it's really hard. Like, you can't, the insurance companies are the ones who ultimately, I mean, the doctor makes the ultimate decision, but then the insurance companies are the ones who will say, yes, we agree to this, or no, we don't agree to this. And it's really hard to justify it. I mean, they have to be somebody who has, you know, pretty significant health issues and pretty significant symptoms to have to be in a detox center. And if they are in a detox center, oftentimes they'll only be able to stay there for as long as they need to get as much of the withdrawal as they can. But for things like opiate and things like that, when there's a prolonged withdrawal, not just the withdrawal, the actual coming off the opiates, but there's prolonged post-acute withdrawal symptoms with all drugs. A lot of times having somebody in a more contained setting is easier for them and better for them and healthier for them because they're being managed. It is, I don't know what it's like to be an alcoholic or an addict. I have a feeling that being told that I can't get my drug of choice when I'm in active addiction is kind of like telling me I can't breathe. And so I can't imagine what it's like to want to use so badly and want to be, it's okay, this is the dialectic. The dialectic is that people want to be both clean and they want to get high, right? Those are both truths. I've been using it for a really long time, so I want to get high, because that's what I'm used to being able to do. I just had a client tell me that the way he has a lot of chronic pain, and he was saying the way that he dealt with his chronic pain for all these years is through drinking, because he didn't care if he was in pain, he didn't care how it was affecting anybody else, because he drank. But then when he gets sober, the pain went back there. So there is that part, and then there's also there's a part of me that feels like I need that. I need to have that escape. I feel like I don't know how to live my life, and so I use substances as a way of being able to try to get by. And then there's a part of me that really wants to be clean, right? So I really don't want to keep living the way I've been living. I see the pain it's caused people in my life. I know how bad this is for my body. I know that I'm not going to live a healthy life if I keep doing this, and so I keep wanting to be clean and sober, but boy, is it hard. And so the goal of treatment is to help people make that less hard, I guess, in some ways. That doesn't really feel like a true statement, though. But really to help people take a look at how to be able to live life sober. I don't know if people ever figure out in treatment why they used. When people ask me, like, am I going to find out why I used so that I don't do it again? And I usually say, no, I don't think so. But we will teach you how not to use again. Like, that part is true. We are going to help you figure out how it is so that you can stay sober and not use anymore. I'm not so sure you're going to find out why, because there's a million reasons why, and who knows? And why do you really need to know? I mean, it's not like, oh, that's why I used. It doesn't work like that. And how would that change anything that you have to do in order to be able to be healthier? Like, I would rather people spend the time figuring out how to live life differently and how to live life healthier than to spend their energy trying to be able to figure out the why. And then there's aftercare, which is after that, which is after people treatment, and that's usually encouraged to be for 1 or 2 years, and people may come back for like a group that's run by a facilitator, not always a staff member. Sometimes the groups are just by other people who have been through the program and have been trained about how to be a group facilitator. But it is really important to be able to keep that level of connection, because what addicts and alcoholics need the most to be sober and healthy is connection, and that is what treatment can provide for people. So there's a lot of ways to be able to take a look at the level of care. There are a lot of ways that if it was a perfect world, we would like to be able to do this, and it's not. Unfortunately, it's not a perfect world, so we can't always get what we want. Sometimes insurance companies preclude people from being able to go in for treatment, or they, there's money involved. People need to pay like their portion of it, and they don't have it. If they had it, maybe they wouldn't be seeking treatment right now. So there's a lot of issues that come into play about how people determine getting care. But the most important thing is that people do get care. Father Martin says you can't lead a horse to water and make him drink, but he also says you can lead a horse to water and make him thirsty. I don't know. I don't care why people come into treatment. I really don't. I don't care if they come in for them. I don't care if they come in for themselves. I don't care if they come in for their pet rabbit. What I care about is that they get there, and once they get there, then they can decide what they want to do. So I hope this helps. Feel free to, contact me and let me know if it didn't or got you more confused. And I am looking forward to seeing you soon.